So as a physical therapist, when someone comes into you complaining of either a chronic tight neck or chronic neck pain, what's your first thought process? We usually immediately go to stretching of the neck, chin tucks, and shoulder blade retraction and protraction. Well, although those do have a time and place, they don't address the source of the problem. So what I want to do in this video is share one exercise that can fix the source of the problem so that you can have better outcomes for your neck pain patients. So before we can discuss the exercise, we first need to understand, what are we going against? What is the source of the neck pain? Not the symptom. The symptom is the neck. It's the complaint that the patient has. But what is driving that dysfunction? Because when you fix the driver of it, you fix the complaint. And there are two main drivers. But before we talk about that, I want to take a step back and say that ultimately the assessment that you do for your specific patient should drive your intentional exercise decision, right? What I'm talking about here are common principles that are usually there when it comes to neck pain. But remember, everything should be specific to your patient. All right. So with that said, what are the two main drivers? The first one is dysfunctional breathing patterns. And the second one is upper trap, scalenes, SCMs, upper neck overactivation. And they really come hand in hand, because when you have poor breathing patterns, the neck has to be on overdrive to try to move the rib cage so that you can breathe, right? So now that we know that, what do we do with it? Well, ultimately, we want to choose an exercise that's going to restore normal breathing mechanics and lengthen the neck. Well, in order to do that, we need to understand, what is normal breathing pattern? Well, there's two key things you want to think about when it comes to breathing: the pump handle, which is the sternum, and the bucket handle, which are the lower rib cage. On inhalation, the pump handle should expand, the bucket handle should expand. On exhalation, the pump handle should compress back down, and the bucket handle should compress back down. Well, what happens with chronic neck pain patients is normally this doesn't move at all, and all we have is the belly moving, right? Why? Well, because there's so much compression going on here that the ribs can't move. So the air is going to find a place where it can move, which is just puffing the belly out and bringing the belly back in. And so with that, that's how we start to understand we need an exercise that restores that. So the exercise should put it where we are getting expansion up here in a way that the neck can actually start to elongate. Now, with those things considered, now we can talk about that one exercise to fix neck pain. So the exercise that we're referring to is postural restoration's upper trap inhibition. It's a really great exercise because it's really simple to the patient, but it's actually really complex, meaning it's addressing the source, and there are so many different things going on. But because the position that we're putting the patient in, they're usually really successful with it. And ideally, that's how every exercise should be chosen, right? So let's talk about what's going on here and why we're in this position. So we'll start at the feet. Notice how there's a box elevating the floor. What that is doing is bringing the knees above the hips, or greater than 90 degrees of hip flexion, to bias more of a posterior pelvic tilt naturally, right? They're not having to work for it. Just by raising the knees up, they're attaining that. Why? Normally, not all the times, but a lot of times, our patients that are in this tight neck and painful neck position, they're in extension and an anterior pelvic tilt. So just by raising the floor, it gets them out of that low back. It's going to help expand and start to get them moving better again. Next, we have a ball. Ball goes between the knees just to maintain a neutral pelvis. That way we're not externally rotating or internally rotating too much. Then you see we have the dumbbells, which are really the key part to this exercise. Now, when it comes to the dumbbells, they need to be heavy enough that they depress the shoulder blades, because sometimes if they're too heavy, we actually see the adverse thing happen. They shrug back up. And that's essentially what we're fighting, right? Most people are breathing in this position. We're trying to elongate the neck and drop and depress the shoulder girdle, right? So you have to be conscious about how much weight you choose. Heavy enough that they feel a stretch, but not too heavy where they fight back. Now, what is the weight doing? Well, when we hold the weight, it's going to, like we talked about, depress the shoulder blade, which is going to stretch the neck, which is part one. Part two, it's going to start to contract the obliques, right? Holding the weights is going to contract the obliques. The obliques are going to compress the bucket handle, which is exactly what we're looking for. If we can breathe through that, we're going to see the anterior to posterior expansion, which is the pump handle, and the exhale is going to help bring everything back down. So it's going to be restoring the normal mechanics just by holding the weights. Now, when your patient's breathing, I want you to cue them that they need to see the chest go forward, right? It needs to go forward, and so that way they're making sure that they're not shrugging their shoulders. So if you put it all together, all you're going to do is hold the weights, chin down, inhale through the nose. As they exhale, cue the arms to get long. The arms should drop on that exhale. And then all they do is maintain that long arm position and take their next inhale. And you repeat this for 3 to 4 breaths, making sure that they're breathing in the right way.